Good morning. I hope you had a good weekend. There are a few situations that I would like to review as a team, and I would like to start the conversation. There was an incident with Ed that was brought to my attention. Ed reported to Judy, a PSW, about how he had been treated roughly by his nurse. An investigation has been initiated into this situation, and I was pleased to hear that Judy did separate the resident from this nurse. She stayed with Ed to listen and to reassure him. She also contacted the charge nurse right away, and I was informed as I was on call. Judy also documented exactly what had occurred before she left at the end of her shift. I've also contacted the Ontario Ministry of Health and Long-Term Care as required by the Long-Term Care Homes Act, and I will keep them informed of any results of our investigation.
Unfortunately, a similar situation was brought to my attention. A housekeeper witnessed an uncomfortable interaction in the hallway where she was cleaning. She overheard staff members speaking negatively to a resident regarding her bath. This resident has cognitive impairment and was responsive to their approach. The housekeeper was unsure of her responsibility, but felt that this was inappropriate.
While Ontario does not have laws requiring mandatory reporting of elder abuse in most situations, there are mandatory requirements for long-term care homes. Any person who has reasonable grounds to suspect acts of abuse or neglect is required by law to report the situation.
So are you saying all staff members have a legal, moral, professional, and ethical responsibility to report abuse and neglect?
Yes, and that extends to our contract workers as well as anyone who provides professional services to our residents as well. These situations require a full investigation to ensure the safety of the resident. We also have the duty to report to the Ministry of Health and Long-Term Care when abuse or neglect is suspected.
It is important for us to provide education to our staff on their duty to report as well as on the Resident Bill of Rights.
We need to review customer service and confidentiality. Friday, Grace, a new resident, was admitted. She was with her daughter Sue, and it has come to my attention that there was a lack of professionalism by the admitting nurse. They overheard confidential information and felt that the admitting nurse was insensitive to Grace's transition into our home. Keep in mind, our team was short-staffed on Friday, and it wasn't our usual admitting nurse.
Definitely, there are some organizational factors that need to be considered to ensure this doesn't happen and to minimize the risks of it happening again. We may need to look at training all registered staff to assist and reinforce that customer service is important at all times.
This brings up a good point about staff stress levels in our home. Currently, we are actively investigating a staff member who made inappropriate comments and admitted to it at report. Her colleague was very concerned as the staff member admitted to threatening a resident with physical harm. This colleague recognized that the staff member is under stress and not doing well. We advised that the staff member should seek professional counseling. But the colleague is concerned about retaliation because they often work together.
Remember, the Long-Term Care Homes Act provides thorough whistleblower protection, that no person shall retaliate against another person, whether by action or omission, or threaten to do so because of disclosure of information. It is important that as a management team, we are sensitive to the consequences of not only the reporter, but to the person under investigation.
So does that include intimidation, harassing, coercing any person reporting a situation?
Yes.
Actually, I had a volunteer approach me very upset about lunch yesterday. She witnessed a staff member speaking rudely about a resident who hadn't received their specialized equipment. She also overheard PSW staff speaking negatively about dietary staff. She said she was very disheartened by the culture and the atmosphere and that it really wasn't a pleasurable dining experience.
I'm surprised. I haven't heard of this happening in the dining room before.
Well, the volunteer has been afraid to come forward for fear of retaliation. She didn't know if this was abuse and neglect. She did know that it wasn't resident-centered care and certainly not pleasurable dining.
Please follow up with the volunteer and explain whistleblower protection and thank her for bringing this to our attention. These situations need to be investigated appropriately, and as a team, we need to identify process and system issues that may have contributed so they can be avoided in the future. In long-term care, we are dealing with a very vulnerable population who rely on us to meet their physical, psychological, spiritual, social, and cognitive needs. The long-term care environment has a duty to protect against any potential threat to those domains that could cause an increased risk of abuse or neglect. We need to ensure that as a team, we address the issues and support open and honest communication regarding abuse and neglect. Prevention of abuse and neglect of the older adult is everyone's responsibility.